Welcome back to the Lipoedema podcast. We are your host, Shell.
Diana, and tonight we are joined with not one, but two very special guests from Medi, Australia. We've got Alex Carver and Jenny Gilbert. Welcome.
Thanks very much for having us. Pleasure to be here.
Yeah, so Alex is the Managing Director of Medi Australia, and Jenny is the Clinical Support and Educator for Medi Australia, who also comes from a Lymphoedema specialist background. So it's so great to have you both here tonight.
Yes, thank you both for joining us. I'm going to kick off tonight's questioning. So we hear all the time how important compression is, and in our last episode, we had Sally Baker talking about how important it is. Can you delve into the new research that is coming out of Germany in regards to compression?
Sure, I might kick off if you'll let me, Jenny, and then I'll hand over to Jenny for the in-depth clinical knowledge that's come out of them. The guidelines have been produced specifically for the German market, and because they are the latest set of guidelines for the treatment of lipedema, we thought it was a good opportunity to delve into them and explore them and see really what's changed and what's new, so that yourselves and your audience can further explore it in their own time. It's a pretty lengthy document. It's 90 odd pages long and it's in German. But what we've done is we've tried to go through it and pick out the parts that we feel are most interesting and most relevant to your listeners. And really, I guess, link that to what does that mean and how it might change their views on the condition. I'll hand over to Jenny to dive into it.
As Alex pointed out, it is a lengthy document, and I don't know that I can really go through all of it just in half an hour, but I thought that I would pick out just a few things that I thought put things into better perspective, because we're still learning so much about lipedema. Every year we learn more than we did the year before, and sometimes we have to do some unlearning. We suddenly realize that we've gone off on the wrong tangent, and that's not right. And then we have new ideas and we have new hypotheses that we go and explore. And sometimes we go down a bit of a rabbit hole, and then we have to pull ourselves back out again as we realize that wasn't quite right. And it can be very frustrating when you have lipedema and you're looking for answers, and we come up with something and then we say, oh no, that's not quite right. We're looking at directing it on another way. And so these guidelines are written, in my view, because it presents the research and the understanding that we have at the moment. It puts it all together and gives some really good facts as to why we are considering certain things about the understanding of lipedema, why it starts, how we should assess it, how we should treat it. And it presents it very well for us. And as clinicians, it helps us better to direct how we can support people who have lipedema. And so one of the things that I thought was interesting is that they've raised good questions about why we shouldn't stick so firmly to the categorization of lipedema in terms of stage 1 looks like this, stage 2 looks like this, stage 3 looks like this. They've started to raise the concept that we should be looking at other factors, but we haven't got that research yet. So don't stick so hard onto this staging that we're going with at the moment. We've been through that with lymphedema. In lymphedema, we used to say you either had Pratox or Card-Tard, or it was either you were born with it or you developed it when you were older. And actually, lymphedema has nothing to do with the age at which it manifests. And now, of course, with primary lymphedema, we're not even looking at the tissue and the character of the tissue. We're looking at much more to do with the genetics of it. And that's going to happen with lipedema as well. We're starting in the very early stages going, it looks like this. Look at the word lipedema. It looked like somebody who might be edematous. And so we gave it that word. So we're getting to learn a lot by that. And I was quite pleased to see that in the guidelines, they've said, look, let's not stick hard and fast on this staging. keep it as an idea, but we're going to develop something better that's going to be a lot more relevant. The other thing that I found very interesting is that they raised, it's just gone out of my head just as I was about to say it. No, I'll have to talk about something else and then it will come back on. So one of the things that as a clinician that I've always looked at, I think we always look at family history, look at whether there's tenderness, we look at the shape, the character of the tissue, and we've always talked about whether there's got this nodular change, this nodular fatty change. And apparently from the evidence that they presented in the guidelines, this criterion of nodular adipose tissue, as they call it, so this nodular fatty tissue, which we used to use so much in the past, really doesn't show enough strength in our findings now. So maybe we shouldn't be looking so much. There'll be some people with those characteristics, but they're suggesting that maybe that's not a characteristic that we should look for in most. So we all have slightly different characteristics as we're expressed in our lymphedema. All of us are a little bit different. There are certain characteristics that are the same. And we really need to look at each person and treat their lipedema by the characteristics that they have, and also all the comorbidities and so forth that individual person will have. And trying to identify what is the lipedema part and what is not sometimes can be a little bit difficult. So I've lost my train of thought then, actually, as I was going on. One of the other factors, I've turned the page over now, they were talking about saying that lipedema should not be regarded as a progressive disease in principle, that its progression depends on various factors. And I was very pleased to see that, because I've not noticed in some of my patients I'd been treating for over 10 years, and I hadn't seen progression in those 10 years. Now, 10 years is only, a seventh of their life. If they're going to live into the 70s and 80s, so it's only a seventh of their life. But the progression wasn't necessarily always there. So I was quite pleased to see that we didn't have to worry so much that everybody's going to be progressive. Again, that'll be another individual thing that will have some bearing with other factors. And
you would have thought in that 10 years of you seeing a patient that there would have been some sort of, if it was progressive, that there'd be some sort of upheaval that would have caused progression in that 10 years. So that's great.
Now, in some people there were, but not in everybody. So again, we don't have to panic. Yeah, there's a point to be careful and to take steps that we're not going to allow it to get away. But it's put a little bit into perspective here for some.
I suppose it demonstrates that the people that you're seeing are receiving management or doing conservative management in some form, because you're seeing them and encouraging that. So I guess the hope that conservative management really does make an impact, which is, we keep harping on about that on the Lipoedema podcast, but I guess this is another bit of evidence that it's not without reward.
Yeah. And the guidelines also encourage us to continue treating people conservatively. That will control their symptoms. So focus on what is going to help control their symptoms rather than, you've got lipedema, this is what you have to do. Let's individualize the treatment and keep the compression going. If that's what's controlling the symptoms, keep whatever's going. So that was another factor of the guidelines that I thought was quite encouraging. Yeah.
May I ask a practical question, Jenny? Just about the fact that the research is telling us to not get so stuck in the stages. But in terms of compression management for lipedema, is there a different approach depending on how severe the lipedema is with what kind of compression is chosen? And has this research influenced any sort of change in that?
It's more so an individual. Does the individual present also with some venous disease, whether or not that venous insufficiency has any relationship to lipedema, or whether it's because they have had clots in DVTs in the past, or whether they've got a family history of venous insufficiency. So It's the individual history medical history that the person presents with, their particular characteristics that they carry with them is what will mainly inform the type of treatment that we would suggest, particularly in terms of compression. Yeah. Sometimes somebody would always have to have it that they feel so much more comfortable when they're always wearing it, whereas other people will do it on a more ad hoc basis on days that they need it, and they might choose a type of compression that they might use depending on what they're going to be doing that day or what discomforts they're feeling. So I'm very much an individual practitioner in that I treat an individual rather than treat a condition. And my decisions will very much be determined on the individual's needs.
And that's so important because we do all present so differently, as you were saying from the research, that we all have these different comorbidities and we've all got these different lifestyles, and we're so multifaceted that just looking at someone and using the same technique right across the board just isn't going to work. So I love that that was highlighted. So with this knowledge that we have now, how will that influence the usage of Medi products?
We haven't changed the products that we used. What it has encouraged us is that we're on the right tracks with Medi. We've got the made to measure and the flat net range, and we've got some of the circular knit range that might be suitable for certain people with lipedema. The Medi Bencosi has been developed really with lipedema in mind, and now they've tried to improve the heel, and in doing so have come up with the lateral seam, which will be a lot more comfortable for those people who've got sensitivity and to get discomfort on their heels particularly. And so we're rather encouraged that it's still a consideration that compression is still a valuable part of treatment, rather than just focusing on the compression only if they have oedema. That in lymphoedema, that if it's helping the symptoms, then this is what we should be using. So with the Medi products, we've got the wraps for those people who find that they can't manage the compression garments, or on some days where it's better. We've got the reduction kit for those people where the shape, it doesn't quite fit into the standard range, or things are changing. Perhaps they're changing lifestyles or surgeries. And then
I guess that's really individual too, isn't it? Because we present so differently. Like some people, there's no way that they could go with a circular knit, like off the rack type garment, because their proportions are, disproportionate. That something just not made for them just isn't going to work, is it?
Yeah, their tissues are very soft, and the circular knit is just going to fill in and create bulges and create crevices or accentuate shapes, and it's quite unsuitable for the character of some people's tissues, but would be quite fine for other people who might have a different shape or different type of density of their tissue, where the circular knit used. I used to use the Mediben Elegance quite a lot. I found that the panty top of the Mediben Elegance was quite comfortable and suitable for those people with lipedema. And then, of course, it looks like an opaque stocking, and it's got various different colors. And for those who find that the panty top of these standard ready-to-wear garments aren't quite suitable for them, even though it's a ready-to-wear product, there is a special option of different types of panty tops. And I haven't counted how many there are, but 12 different styles of panty tops, dependent upon the particular characteristics you are. So are you somebody like me that has quite an ample derriere, or are you somebody who's got it slightly flatter, but they've got a little bit of an ample tummy? And then the panty top can be determined on their shape and their figure. So if the standard panty top doesn't go, you're not having to pay the price of a made-to-measure garment, but it does consider the different figures that we present with. So I used to find that quite useful.
I have a specifically for my pregnant belly, which I appreciate so much. Although I'm getting to the stage of my pregnancy where putting garments on is like the Olympics. So I don't know for the next few weeks until I give birth whether I'll be wearing them very much. But I have very much enjoyed the fact that I could continue some form of compression use throughout most of my pregnancy. It's been really useful, I must
So
say.
you conduct your pregnancy yoga whilst donning your compression.
Oh, I tell you, it's a sight to see. Yeah, not to go live on socials or the podcast. Jenny, you mentioned a reduction kit. Can you talk a bit more about what that is? I've not heard of that before from Medi.
So that is it's a compression wrap, and it's the same where it's got a material with straps with Velcro that's attached. But with a reduction kit, it comes in two parts. And you measure the limb in certain places, and then you measure out the one side, one part of the wrap, and you measure where their circumference is along this side of the wrap. And you can then cut it. For instance, if you've got the wrap for the lower leg and the half of it will have the measurements along it on the top and on the bottom and sometimes in the middle, and then you'll measure up what the circumference is for the below the knee and what it is around the ankle, for instance. And then you'll draw a line and cut along it with a bit of a margin, and you attach the next side to it so that now you've got a garment that's fitting the proportions and the shape of your limb. And so if you've got a different shape, then you've got a garment that's specifically designed for the shape of your limb. And if your limb changes, then you just take the Velcro off, you remeasure your leg, you adjust the measurements, you cut a little bit more off. And so as your leg is changing shape, then you can continue to change the wraps. And there is a system that you can gauge a little bit the pressure, so that at least you know that you're applying even compression on each strap all the way up, that you're not applying too much pressure at the top, for instance, and not enough by the ankle, and then causing a little bit of a problem with drainage.
Yeah, that sounds great. Is that a garment that you would recommend using overnight rather than something that you'd wear during the day, or could you wear it at any time?
You can do. I like the knee is my favorite because it's the thinnest knee wrap that I've ever worn. So I particularly like that one. I prefer that for all the wraps, actually. It's the knee wrap. It's so thin and conforms to the shape of my knee. I feel as though I can bend my knee much easier in that than I can any other wrap. But you can do it for the thigh, the knee, and the lower leg. And then there are various rather like the Lipoedema, the garment that has a compressive foot part, but it's only a liner. If it fits if your leg fits the size of it, then you don't have to wear a foot part. And with lipedema, where we don't really have very much foot edema, we probably don't need much more than a bit of a thumb sock and a shoe to look after that. Don't have to have anything big and bulky on our feet.
Yeah, it's good to have the foot part just for a little bit of flow effect, because I found some garments that I used in my early diagnosis stopped at the ankle, but then with the ankle cuffing, it just exacerbated it so much more. So having that flow on to the foot, even if it was toeless, but having it down past the ankle, like it was just something that I absolutely needed.
Yeah, absolutely. Yeah, I quite agree. Yeah.
I think Jenny's done a
I'd-
fantastic job there in explaining what it is. To simplify it, because I like things in lay terms, it's a bit like a DIY made to measure wrap, a reduction kit. And the healthcare professional, your therapist can measure whoever it is that needs it, but then there and then cut it to size for the patient. So
the practitioner would cut it.
Yeah. We train healthcare professionals to do that, and then they can adjust it as well over time.
Yeah, that sounds really cool. And is that a full leg, or it comes in pieces, or you can customize it
comes
that
in
way?
pieces.
Yeah.
Yeah. So there's a lower leg, knee, and upper leg, and then there's an arm. There's even a reduction kit for the arm. Yeah.
Okay. Wow.
That can be quite
That's
handy
cool.
for those people who are reducing either by weight or by surgery.
Yeah.
In terms of what Jenny was talking to, where it's about treating the individual, there'll be some people where they're not ready even for a made-to-measure garment, and they're at that stage in their journey where there's fluid to be reduced within their limbs. This is the perfect solution for them, and then get them to a stage of maintenance where they can then go into what would usually be a made-to-measure flat-neck garment for them.
Right.
That's
Yeah, and
right.
I
And
think
if it can be adjusted, then it'll serve them longer too, won't it? Because as they're going through that reduction phase, their therapists can adjust it for them and until they're got rid of all of that fluid and can be ready for the made to measure. Oh, that's exciting. I like that.
It can be an
I
option.
like
It's
that
not an
too.
option for everybody, but it can be an option. We always need a lot of options available to us so we can find the right one for the individual and also sometimes the health professionals who are working with them.
Yeah, that's right. And this is probably a really good segue into a question about the different products you offer to service the Lipoedema community. Have some corresponding conditions and a lot of inflammatory conditions such as arthritis and mobility issues, making garments difficult to don and doff. I know in my case I don't have those, but at the moment with the pregnancy it's really hard to don and doff my garments. I know that Medi has a few different products that can help support people to do that. Can you just talk through some of those products that you have? I know there's something called the butler, and then you can have your garments set in pieces. So I'd love to get some more information from you.
So we have some butlers. How to describe a butler, really? So it's a frame that has a half moon shaped, U-shaped part of the frame. That's it. And you apply the compression garment over this U-shaped part of the frame. And that stretches and opens the compression garment. And you pull it down so that the distal part, so if it's a stocking, you've got it down to the heel. And then the frame will have handles on it, and you can have short handles or long handles or varying height of handles dependent upon what your flexibility is. And you put your foot into it. I have to say, it does take a bit of practice. The first time I did it, I got my foot stuck and I had to take it out and start again. And then I had to learn at what point, as you're sticking your foot into it, do you then bend your ankle to get the rest of it in? I went in with my toe and hit the floor. And I said, okay, you have to bend at some point. Yeah. So it takes a little bit of practice to get it right. And are you going to do it when you're standing? Are you going to do it when you're sitting? But it helps it then to be able to pull it up to, for me, I get it up to my calf. And then you slide it out. There's an arm butler that I think is marvelous. And this is great for people who perhaps have difficulties pulling the garment up, or they've got shoulder problems and they're just trying to pull it up on the other side is a problem. And this is it's still a frame, but instead of having handles, it's got a little piece that's bent over. So you push it over a table, for instance. It clips just onto the edge of a table or a kitchen table, and you put your arm into those half moon shape frame that you put your compression sleeve over, and you slide your hand into it, and you can use your body weight to push your in, and then your other hand is just guiding it up. I've used it a lot, and not so much in the Lipoedema community, but when they've had inability to raise the shoulder, or they've got a bit of partial paralysis of the arm, where they don't have the ability to put the garment on terribly easily. But it helps also for those who've got arthritis and they can't do the pulling, or they've got the shoulder problem. So the arm butler I find is really quite useful. Other than going away from the frames, going back to frames. The only one I haven't used is a frame for pantyhose. It exists, and I've seen it, and people have used it, but I think that's just amazing to have a compression garment that you can put a pair of pantyhose onto. But they also have the two-in-one. So this is some sort of slippery material. It's silky, satiny type of material, and it's a funny shape. One end of it is like a bit of a sock, and the other end of it's a bit like a tongue. And it depends as to whether you're standing on the tongue bit of it in a certain way so that you can then help to get the garment up, or you put your foot into it like a sock and then raise the tongue up and tucked it underneath your garment so you can slide the garment off easily over the silky material. So it's all about trying to make things a little bit easier. The easiest would be if we just could click our fingers and it was off, because all of these aids have some effort that goes into it, and it's just a matter of finding the one that is right for you. We've got the butler off, which is a little bit like a shoehorn with a kink in it, and it's particularly designed at an angle so you can slide it down the back of your calf and then down toward the ankle, captures onto the compression garment that you pull down as low as you can. And then it slides through this angled shoehorn down underneath the foot, and off goes the garment.
Oh, I've got to try that. I do this funny dance trying to get mine off. I like get them so far and then I dance with my feet pushing them off.
Yeah. That's a very good method. You don't need anything other than your own feet, but it's a very effective way of getting garments off. Yeah. As long as you're making sure you're not falling over. Yeah.
It's super entertaining.
I don't know if we're be responsible for depriving the world of your dancing shout.
That's maybe you straight your doffing method sometimes.
Yeah, I think we've done a donning tutorial on socials, but I don't think we've ever done a doffing like in the last. That would be very funny.
Yeah. But there are not donning aids, not like other companies have some other alternative donning aids, and it's a matter of finding the one that's right for you.
Yeah, great. Thank you. Lots to choose from. And all of those products would be on the Medi website, because you have two different sort of websites to order product from, depending on what kind of product to order. And I don't want to jump the gun here because we're asking that question later on in the piece, but those butlers and everything can be on the Medi retail website.
They're on my website, yeah.
Yep.
Very good.
Yep.
Very good.
Yep. Yes. Often on the accessories.
Are there any new products coming to Australia that you want to talk about?
Give us the go.
There are. I guess the ones that will be here soonest will be our new trend colours. So we've already released to the world what they are, but coming 17th of September 2024, we'll have new trend colours available, which are light blue and russet red. We'll still have sage green and lilac available. So lilac, pretty much the purple of Lipoedema. Yeah, very relevant colour for your audience.
You have a new pattern?
Yes, thank you. Yeah, and new trend patterns as well. We'll have one leave the collection, which is the sort of classic design and fashion element, and then it's being replaced with one that's called Wild, which looks like sort of animal footprints almost into the fabric. It looks really good. If you go to our website, you can see the options that are there. But I guess to answer your question fully, Cheryl, we're continuously innovating products. Jenny's mentioned briefly that to create the lateral seam on the Medi Cozy, we had to redesign how the heel was knitted. And you might think, well, you guys are knitting garments all the time. Surely you got to the grips of that. But moving the seam of a garment on a flat knit is quite a technical process. But what they've done is they've optimized it for comfort and then made that the new standard on all the garments that we make for that particular fabric. So that one's Medi Cozy. So there's continual tweaks that we are making throughout the life cycle of a product, not just changing colors and design patterns. We're continuously trying to keep the people that use our garments front of mind for that and drive the solutions through minor innovations like that.
like the options
awesome.
that we can offer. Like each time we find that we need to offer something else. So we've got lots of different options that you can have, particularly with the made to measures.
Yeah. Now, I may be jumping the gun here. So, Alex, I please apologize if I am. But on one of the American sites, I did see a compression pump. Is that something that we might get in Australia?
Possibly anything's possible. Compression pumps are medical devices. So there's a conversation that would need to happen with the TGA around that, which we haven't had yet. That's something that, Medi USA, which, one of our bigger group companies, made the decision to do. It's been tremendously successful for them, and we'll never say never. I'll leave it at that.
It's a good attitude to have. Love that. I also thought, I'm going to put you on the spot again, that I think America or the UK, they have like sports garments as well. Are we?
Yeah. So Medi's a group of companies. We're 3,500 people across 26 countries that we're directing, and well over 100 that we operate through distribution channels. And I guess peers of mine in those other countries can choose to some extent what additional products that are non-Medi that they can sell. Within the Medi family or the Medi family of companies, we do have a sister company that is CE. There's an active wear apparel component to what they make. So it's part of the Medi family, but you're more likely to see it on the athletes that are in Paris at the moment. Patient that requires compression for varicose veins or for lymphoedema.
Sure.
Really, again, Medi starts with the end user in mind, and the people that are going to be doing triathlons or riding the Tour de France, that's not necessarily going to be somebody that needs medical grade compression. That said, some of the products are knitted on retrofitted medical compression machines, but we don't test it in the same way that we test our medical garments. Whilst they're still manufactured to the same high standards, we don't have to guarantee it like we do with our medical garments. And the fabrics and the yarns that make our medical compression so special are different to those that are in the active wear. I don't know if I've answered your question, because CP is available in Australia. It's just that don't tend to promote it for use in the medical community. That said, if it's something that a healthcare practitioner said, do you know what, you're okay with just wearing bike pants or running tights because of who you are as an individual, then we help those individuals.
I've had a patient, again, we all have to treat the individual, and they are a triathlete. They compete in triathlete, or what's the word you call them? They are triathletes, aren't they? And they compete in triathlons, yes. And I couldn't do that in their medical grade compression garment. It's not designed for getting into the water and then getting out of the water and running and then getting on a bicycle and then hoping by the end of it that you come away with not having areas of excoriation. And the medical compression garments aren't designed by that. And yet competing was important for them. And we worked together, and they found some compression garments that has designed that they can bend their knee and run and get on a bicycle, and they can get out of the water and it dries. And then when they finish their event, they do whatever they need to do, because I had no idea that events make people swell. It's like a different type of swell. I thought they were uber fit people would never, but actually there's so much exercise that they tend to. So they've got a lot of things that they do after the event to make sure that they keep themselves well and flexible and nimble, and they can get up and the next day. And then they get their compression garment back on, and it enabled them to manage their condition much better and live the life that they wanted to live. And so that's
love that.
The CEP in with their conventional Medi compression garments.
Very cool. And I also want to shout out to those people in our community who live in the northern parts of Australia where it gets really hot. And I just wanted to get from you guys that in terms of the durability of the made-to-measure garments, can we wear them when we go swimming? As in pool, beach, can we get them wet? So if it's summertime and we're particularly really hot, can we spray them to keep ourselves cool? What's the deal with the made-to-measure garments and how to keep ourselves cool in the summertime?
Do you want me to answer that one, Alex?
I've got some ideas as well. I'll let you go first.
Yes. There are lots of things to try and keep it cool. One of the things that's integral in the Medi, most of the Medi products, is the ClimateFresh and ClimateComfort technology. And the ClimateFresh technology is where they have made the threads in a way, spun the threads in a way that once they knit it into the knitting pattern, and I'm not a knitter, so I can't really understand knitting patterns, but apparently they do it in a way that wicks the fluid and the heat from the skin and outside to the outside of the garment, so that it keeps the limb cooler on the inside of the garment and stops it from getting wet. It used to happen in the traditional old-fashioned razzmatazz stockings that we would wear, and even if it's in February and you're trying to walk around, I come from Dalby, so it got really quite hot, and you'd feel all the sweat running down your legs inside these. It doesn't happen to the same degree. Oh, not at all. And I had an experience where I went into the heat and I didn't know how I'd manage. And actually I was quite cool. So for me, I found that the ClimateFresh technology helped to keep my legs cooler. But you're quite right. Some people put their compression garments into the freezer and then they put it on afterwards. That's really good. It lasts so long until you get hot, and then it needs to go back into the freezer, but you can't put yourself in it with it. Then there is spraying. And as long as you're not spraying with an oil, if you're spraying with a water base like a menthol or something like that, sometimes that can be helpful. I don't like to spray it too much, but coming from Brisbane where it's really humid, I find that adding extra water is not necessarily so helpful. But wetting it and then standing in front of a fan can be really helpful at that point and cools you down quite nicely. And then there's also Medi Duo, a day cream that's quite cooling. So you put it as a cream before you put your garments on, and that can have a little effect. There's no one great way that's going to be really helpful unless you keep yourself in a freezer. But if you use various different options throughout the day, you can usually keep yourself pretty comfortable.
Yeah, nice. That's some good tips there. Thank you. I alluded to it a little bit before, but Medi have two separate websites to get products from. One is the retail website, and the other one you can order the made-to-measure garments. Can you please just talk through how might our community get hold of specifically the made-to-measure garments?
I can answer that one. So with made-to-measure garments, we would always recommend that you go and see a healthcare professional, ideally that we have done some training with, or one that's experienced in measuring for compression garments. I know that Lipoedema Australia have some resources on their website. I'm not sure if they have a directory yet of therapists. However, the Australasian Lymphology Association, or the ALA, does have a find a practitioner directory. So you can go on there and search from your postcode and find somebody that is ALA registered, call them and ask, can you measure me for made-to-measure compression garments? Failing that, people can contact us and we can point them in the direction. I know that you've had Joe and Claire from Custom Medical Stockings on the show before. They do a great job of looking after sort of southeastern Queensland, and there are other similar services that are available around the country, because obviously not everybody is based in their catchment area. So people can reach out to us and we can point them in the direction. But I'd say the ALA is the best sort of first step on that.
Yeah, perfect. And I suppose if you've got a diagnosis of lipedema and you're going to a therapist of some kind, they should be able to point you in the right direction for trying to get some garments, surely. And the lovely ladies at CMF are fantastic if you live in Southeast Queensland, so that's good too. This episode goes live on the 22nd of August, which means that your new colours will be out at that time. So if you are wanting some new garments and you're looking for some fashion colours, head over to the Medi website and check out the new colours and styles. I'm going to put you on the spot again, Alex, because I know that we had a discount code previously for Medi Australia, and it was Lipo Lifestyle, and you could use it on the retail website and use it for custom garments. Are they still active?
If they're not, they'll be reactivated. How's that?
I love that. That makes me so happy. And I believe that it was 20% off on the retail site. And if you were ordering some custom garments, it was buy one, get one half price, I believe. And if that changes, you let us know and we can edit this to make sure that we're getting it correct.
We can provide details of it in the show notes for you. How's that?
Love that. Thank you so much. That's all the questions that we've got. Shell, do you have anything else before we wrap up?
No, that was amazing. I think we did it all. That was a lot of information.
Yeah, it was. Well, thank you so much for being generous with your time, Alex and Jenny. We really appreciate you, and we appreciate the Medi products that we've tried. We can't wait for anything else that comes out in the near future and look forward to catching up with you guys soon.
Lovely. Thank
Awesome.
you.
Thanks, guys. I'll just, if I may, just sign off by directing people, if they do want to research and read these new guidelines for themselves, the best place to find them, or where I found them, is through the International Lipoedema Association. Or if you Google German guidelines on lipedema, you'll get taken to a site that is in German that you can download. But there's all sorts of weird and wonderful AI things out there that will help translate it. And that way people can have a read and, educate and do some self-education on it.
Yeah,
Awesome.
thank
I
you
will
so
find
much.
the link and I'll put it in the show notes.
Done.
Thank
Yay.
you so much, Alex and Jenny.
Bye.
Thanks,
Jenny.
Nathan. Doris.
Bye.
When we started the Lipoedema podcast, we relied on word of mouth and existing connections.
Our following has happened organically, and we are so honoured by your support.
As we learn more about the world of social media and algorithms, we have a request.
When you are listening to our podcast or watching on YouTube, let us know what you think.
Hit follow or subscribe.
Leave us a comment or write a review.
The more engagement we get, the more our message is shared.
And the greater our reach to those women suffering in silence.
Thank you for listening to the Lipoedema podcast. Lipoedema and its symptoms vary from individual to individual. The opinions and advice voiced in this podcast are of a personal nature and used for educational purposes.
Please take away from this podcast what resonates with you, and please see your GP or preferred specialist for diagnosis and healthcare. We are Shelley and Tiana from the Lipoedema podcast. Until our next episode, bye for now.